Hello and welcome. During this presentation, we'll be teaching you the ins and outs of handling respiratory emergencies. So what are respiratory emergencies? Basically, it's just any issue that affects breathing. This can mean your breathing has stopped, it's become difficult, or anywhere in between. But why do they matter? Well, if you haven't realized, breathing is pretty important. But in all seriousness, if breathing stops, blood stops flowing to the brain, and your heart may stop too. And either of these situations can lead to death or permanent damage, and those are seriously likely outcomes. And so this is why when it comes to breathing emergencies, we work fast, we take them seriously, and we prevent that damage. So respiratory emergency is a pretty broad term with a huge variety of conditions under the umbrella. So today we're going to focus on some of the most common, if not most treatable, of these conditions. First, we're going to take a look at respiratory distress and arrest. Respiratory distress is the most common respiratory emergency, generally meaning that a person is experiencing some difficulty breathing. If prolonged, respiratory distress can become respiratory arrest, meaning that breathing has stopped altogether. So here we have a quick list of our symptoms of respiratory distress. Some of the hallmarks being gasping for breath, changes in breathing rate, and changes in skin condition like becoming pale, ashen, blue, or the skin becoming moist. So if someone is experiencing these symptoms, it's important to follow these simple steps in order to care for our victim properly. And now that we know a little something about respiratory distress, I'm going to hand it over to my friends who are going to give us a brief rundown of what respiratory distress might look like in the real world.
Hello, my lovely assistants. Hi. All right, it would be such a shame if one of you were to fall into respiratory distress, wouldn't it? Oh, Frank, look at you. You already have the symptoms. We have wet skin, gasping for breath, gasping, Frank, and we have pale ashen skin. He already kind of matches. It works. All right. So, what are you going to do for him?
I don't know.
Okay, first we position him comfortably.
3/4 supine.
Actually, sitting up might be better in this situation.
Okay, let's go in a chair. You good?
Good, good.
Now what?
Now comfort him. Reduce his anxiety.
You're probably not gonna die.
That's not very comforting.
You're not gonna die, don't worry. Now what?
And then we just wait for help to come. Did you call 911?
Hello? Yes, we need help. Come to Wayne State. And then, oh no, oh no.
Oh.
Oh no.
Oh, looks like he went into respiratory arrest.
What do I do now?
Now we do CPR.
Now CPR, okay.
Nathan, what are you doing?
I don't want to get sued.
You'll get sued if he dies.
Uh-oh. So what? CPR?
CPR.
Okay. Okay.
Remember, 100 beats per minute.
First when I was petrified.
That's the wrong song.
Okay. Another one bites the dust. Another one bites the dust.
I guess that's better.
And then...
Thanks, guys. And now we're going to take a look at a specific condition, asthma attacks. So asthma is a common condition and it causes constriction of the airways due to inflammation. And as we can see, there are a variety of potential triggers like allergens or exercise, but it varies a lot from person to person. So here are some of our asthma attack symptoms. We want to pay special attention to wheezing though, because it's one of the key signs of asthma-related distress. Handling an asthma attack is similar to general respiratory distress, except if you know someone has asthma and they have a fast-acting emergency medication like an inhaler, you'll assist them with administering it. So once again, we're going to hand it over to my pals and see what asthma-related emergency looks like.
Welcome back, my lovely assistants. Who is ready to help me show what an asthma attack looks like? Frank? Just kidding, this isn't lab discussion. Nathan! So, yeah, there's that classic asthma attack wheezing. And you know, some people get a little sweaty when they have asthma attack. No? Nobody cares about authenticity anymore. All right, Frank, go ahead and get him seated comfortably.
All right, come on, have a seat right here.
Help him administer that medication.
What am I supposed to do with this?
Well, first you shake it. And then, you know, you have to take that lid off.
Right.
Yeah, you asked for instructions. And then you're going to help him administer it. So So put his hand on the button, put it to his mouth, you know where it goes, and press.
Press.
Oops. And hold for 10 seconds. You know that wasn't 10 seconds, right? That's fine, whatever. All right. And then if he doesn't get better, we call 911. You're fine. Come on. All right.
Fine?
You're fine.
Okay.
All right.
Let's do this again.
Good work, guys.
So now we're going to take a look at anaphylaxis. So we know people have a variety of allergies and they vary in severity of their reactions too. But it's important for us to know how to handle the most severe of those reactions, the ones that cause that inflammation and swelling that restricts breathing. So what we're going to look for in anaphylaxis is symptoms very similar to respiratory distress, except you have some specifics like rashes, itching, tightness in the chest and throat, and it's all going to follow an exposure to an allergen. So if you know someone's having an allergic reaction and they have a prescription EpiPen, you're going to assist them with administering it, much like you did with asthma. And now that we know a little bit, we're going to head over one more time to our friends and see how they would handle anaphylaxis.
Hello again, my lovely assistants. I'm sure you're excited to see me again. All right, so who's ready to show what allergy reactions look like? Any volunteers?
Good.
No? No? All right, hope no one's allergic to peanuts. No? No? Oh, look at that! I think Frank is! Okay. Oh, my bad. All right, so get him seated comfortably. I'll call 911, and then we'll try out Frank's new EpiPen. See? EpiPen, real. Ooh.
Oh, I've seen these in the movies.
Yeah. Whoa, no. That is, first of all, that's upside down, and that's his neck. So, for our EpiPen, there's a very, very simple way to remember how to use this. It's blue to the sky, orange to the thigh.
Okay.
So just, you would take the cap off the back.
Take the cap off.
Put the orange part to his thigh and have Frank press the button. Hold for 3 seconds, 2, 3. And now Nathan, massage the injection site for 10 seconds. Go ahead. Very professional. Beautiful. How you feeling, Frank?
Feeling a little better.
Okay, good. So we'll stay with our victim until 911 arrives.
Okay.
Thanks for volunteering, Frank.
All right, so now that we've seen all this, hope you have a better understanding of how to handle a respiratory emergency. But if you remember nothing else, remember respiratory emergencies are serious and potentially deadly. So when in doubt, never be afraid to call 911. Thank you.